We have just explored sleep, a necessary and involuntary altered state. You can certainly voluntarily not sleep for a while, but there will be a point where you will involuntarily fall asleep. And so it's necessary part of fully resting as not just your body but your brain. This week we're going to look at a few voluntary forms of altered states. We'll start with meditation, which is a voluntary altered state that is based on concentration. Secondly, we'll look at hypnosis, which involves suggestions. And then lastly, we're going to look at psychoactive drugs, which involves choice. And these would be the three that we're going to look at to wrap up states of consciousness. Let's get started. Meditation is the practice of focusing attention either on a word or an object or your breathing. Now, not all meditations are sitting or lying down. There are walking and other moving techniques. The aim is to block out all distractions and to attain an alternative state of consciousness. Now, meditation has been supported by physiological changes. It can positively affect your heart rate, your blood pressure, and with brain imaging, it shows brain activity levels changing during meditation. Now, meditation techniques, there's a variety of them, and generally you find a quiet spot, you sit or you lie down in a comfortable position, and you'll find one on page 84, and you might want to give it a try and see how you feel when you're done. Now, meditation does take a little practice on how to get used to letting your distractions in your head, just letting them go. It's not something you can do just automatically. It takes practice to learn to focus and to, if you will, just sort of clear all distractions out. And essentially, it's a process of, as things come in, you let them go out and you don't focus on them. And it's not straightforward and easy, but it's worth giving it a try. Hypnosis is an alternative state, but this one is a technique that uses focusing of attention and suggestibility and lowering in a lowered response to external stimuli. So essentially, in a hypnotic state, a distorted perception can be gained, giving rise to perhaps seeing or feeling or even tasting things that aren't really there. Now, most people can be hypnotized to some degree. And I've even seen it used in a medical circumstance. I did some research in university on hypnosis, and I went to a dentist in Kitchener that used hypnosis to help patients numb the pain in lieu of anesthesia. And what he did was he would hypnotize them and would put a clothespin on their earlobe, saying that, and giving them the suggestion that this was going to dull and null pain. And I watched him do drilling on a person's tooth with a clothespin on their ear and no anesthesia, and it worked. So the hypnosis was and is a way of it's an altered state, which you can not only experience some things that aren't there, but you cannot experience some things that are there. It's quite remarkable. Now, lastly, as another state, is drug dependency or drug issues. Psychoactive drugs is any substance that alters mood, perception, or thought. Now, there's a couple of things associated with this. That physical drug dependency is the compulsive pattern of drug use in which the user develops a drug tolerance. Now, the more you use the drug, the larger and larger the doses that are needed to get to the same effect. Withdrawal symptoms will often appear if the drug is discontinued or disappears when the drug has been taken again. Now, what's oftentimes more significant than physical drug dependency, if you've ever smoked cigarettes and you quit smoking, after a little while, the physical need for a cigarette disappears, but it's the psychological dependency or the psychological effect that reappears. And the psychological dependency is a craving, an irresistible urge for the drug's positive effect. This is often more difficult over the long haul than physical dependencies. Now, there are some features or factors that influence the addictive potential of drugs. First is how quickly the effect of the drugs are felt. Secondly, how pleasurable the drug's effects are. Thirdly, how long the pleasurable effects last. And fourthly, how much discomfort is experienced when the drug is discontinued. And these four factors will influence the addictiveness of a potential drug for any one given person. Now, there are a variety of psychoactive drugs, and let's review. Now, these aren't ones you aren't familiar with. You've probably heard of them before. Now, stimulants, these are drugs that speed up activity in the central nervous system. They tend to suppress appetite, make a person feel more awake, alert, and energetic. Common stimulants are caffeine, nicotine, amphetamines, and cocaine. Now, caffeine is the world's most widely used drug. It makes us more mentally alert and can help us stay awake. Nicotine is a highly addictive stimulant as tolerance develops within hours. Tolerance developing just really means that you get used to it and you build up that tolerance where 1 turns into 2, turns into 4, turns into 10. Okay? Amphetamines increase arousal, they relieve fatigue, and they suppress appetite. But with continued use, they result in exhaustion, depression, and agitation. And cocaine causes a feeling of euphoria and is highly addictive. Heavy use can cause heart damage, seizures, even heart attacks. Now, the second group is what are known as hallucinogens. Now, hallucinogens alter perception and mood and cause hallucinations. LSD is a powerful hallucinogen with unpredictable effects ranging from perceptual changes and vivid hallucinations to states of panic and terror. Ecstasy is a cross between a hallucinogen and an amphetamine, and it causes a feeling of relatedness and restlessness and connectedness with others, but it can cause permanent brain damage to the serotonin release neurons. Now, as you would imagine, and as we've seen in the news more now, marijuana, it produces a feeling of well-being, relaxation, and lowers inhibitions and anxiety. The users may experience giddiness, increased sensitivity to sensory stimuli, and perceptual distortions and hallucinations such as a slowing of time. Marijuana has been used to treat glaucoma and control nausea and stimulate appetite in patients receiving chemotherapy. It's been used also with persons with social anxiety, depression, PTSD. There's a growing list of potential and not all fully understood benefits and risks, especially in the use of marijuana among young people in their early teens. Not already developed brains and the effect that THC may have on that brain development. There is some evidence that heavy marijuana use can cause memory problems, respiratory problems, loss of motivation, impotence, lower testosterone levels and sperm counts, and irregular menstrual cycles and lower birth weight babies. Let's move on to the last class of group of altered psychoactive drugs, and these are known as depressants. Now, depressants, these decrease the central nervous system and slow down bodily functions and reduce sensitivity to outside stimulation. Depressants usually include sedative hypnotics like alcohol and barbiturates and minor tranquilizers, and also narcotics in terms of opiates. Alcohol decreases anxiety and inhibitions at low amounts, and higher amounts of alcohol lead to symptoms of drunkenness, such as slurred speech, impaired judgment, and poor coordinations. Too much alcohol can cause a person to lose consciousness or die. Barbiturates act as sleeping pills. Excessive use can be fatal. Narcotics, which include opium, codeine, morphine, and heroin, have both pain-relieving and calming effects, but opium is also, in its earliest form, opium is the earliest form of this drug. Morphine is a more refined version of opium, but is highly addictive. And heroin is believed to be the purer form of morphine and therefore less addictive, but in fact is even more powerfully addictive. Methadone has the ability to control the symptoms of heroin and morphine withdrawal without the euphoria or high of heroin and morphine. So this concludes our look at consciousness and altered states of consciousness. I hope you found it interesting. I hope that it's given you some new insights about what might be your consciousness and how your consciousness affects your day-to-day experience. So let's carry on the good fight and see what we have in store for the next week. Good luck, everybody. Bye now.